Did you know that over 20 million hernia repairs are performed worldwide each year? Surprising, isn't it? Hernias are more common than you might think, affecting both men and women, young and old alike. It's a global health concern that knows no boundaries. From bustling cities to quiet rural hamlets, hernias are widespread and prevalent. But don't let these startling figures intimidate you. With numbers that high, it's crucial we dive into what exactly causes a hernia and how we can prevent it. A hernia might seem like a simple bulge, but there's a lot going on beneath the surface. To understand hernias, picture part of an organ or tissue that squirms its way through an opening or weak spot in the surrounding muscle or tissue that normally keeps it in place. This can happen in various parts of the body, leading to different types of hernias. The most common type is the inguinal hernia, where the intestine or fatty tissue pushes through the abdominal wall into the groin area. On the other hand, a hiatal hernia occurs when part of the stomach protrudes up through the diaphragm into the chest cavity. Umbilical hernias are seen around the belly button, especially in newborns, but also in adults with increased abdominal pressure. Lastly, incisional hernias can develop at the site of a previous surgical cut, where the tissue has not completely healed. Several factors contribute to the development of hernias. Lifting heavy objects without proper support or technique can strain muscles and create weak spots ripe for hernias. Persistent coughing, which puts continuous pressure on the abdominal wall, can also lead to this condition. Obesity increases the strain and pressure on abdominal muscles, potentially causing a hernia. Poor nutrition can weaken muscle walls, making them more susceptible to tears and bulges. Additionally, some individuals may have a genetic predisposition that makes them more likely to develop hernias. Understanding these triggers is your first step towards prevention. Now that we know what causes hernias, how can we stop them in their tracks? First and foremost, maintaining a healthy weight is crucial. Excess body weight can increase pressure on the abdominal muscles and tissues, making them more susceptible to hernias. Regular exercise and a balanced diet can help manage weight effectively. Speaking of diet, it's not just about controlling weight. Eating a diet rich in fiber is equally important. Foods like fruits, vegetables, whole grains, and legumes can prevent constipation, which often causes people to strain during bowel movements, putting extra pressure on the abdominal walls. Another key aspect of prevention is mastering the art of proper lifting techniques. Whether it's during a workout or while moving boxes, always bend from the knees and lift with the legs, not the back. This method helps distribute the weight more evenly and reduces strain on the abdominal area. For those who have a chronic cough or frequently sneeze, managing these conditions is vital. Continuous coughing can weaken and eventually tear the abdominal wall. If you're a smoker, quitting can reduce coughing episodes and decrease your risk. Consulting with a healthcare provider for effective treatments can also control persistent coughs. Lastly, engage in strengthening exercises for your core muscles. Exercises like planks or pelvic tilts not only enhance core strength, but also fortify the abdominal wall, providing it with better support against potential hernias. Preventive measures can significantly reduce the risk of developing a hernia. Sometimes, despite our best efforts, hernias can still occur. So, what's next? First and foremost, it's important to remember that treatment options for hernias depend on the size and symptoms. For minor cases, a method known as watchful waiting may be recommended. This approach involves monitoring the hernia for changes or complications without immediate surgery. However, if the hernia is larger or causing discomfort, surgical intervention might be necessary. There are two main types of surgery for hernias: open surgery and minimally invasive procedures. In an open surgery, the surgeon makes a single, large incision to repair the hernia. On the other hand, minimally invasive procedures like laparoscopy involve several small incisions. The surgeon then inserts a tiny camera and instruments through these incisions to repair the hernia. Both methods have their pros and cons. Open surgery can result in a longer recovery period, but it's a tried and tested method. Laparoscopy, while promising a quicker recovery and less post-operative pain, may not be suitable for all types of hernias. After surgery, post-operative care is crucial. This includes following the doctor's advice, taking prescribed medication, and avoiding strenuous activities. Furthermore, lifestyle adjustments might be necessary to prevent recurrence. These could include maintaining a healthy weight, avoiding heavy lifting, and incorporating regular exercise into your routine. With the right treatment and care, overcoming a hernia is entirely possible. Let's quickly recap the essential points we've covered about hernias. Firstly, hernias can arise from a combination of muscle weakness and strain. Factors like lifting heavy objects improperly, persistent coughing, or obesity can increase your risk. Preventing hernias involves maintaining a healthy weight, strengthening core muscles, and using proper lifting techniques. If a hernia does occur, treatment options range from watchful waiting to surgical interventions, depending on the severity and symptoms. Always consult healthcare professionals for a diagnosis and personalized advice. Stay informed, stay healthy, and remember, managing hernias effectively is within your reach.